So stay connected, stay engaged, stay in the game. Get connected through the Louisville Alumni Network and use your mind, skills, and talents to make the university, your community, and beyond a better place.
And Angela, you can take it away.
Oh, thanks. Caitlin, did you have some housekeeping information for us before we get started?
Just another reminder that we are recording. So if you do not wish to be on the recording, if you would not wish to be seen, go ahead and turn your camera off at this time. And if you have any questions, please drop them in the chat. You will be muted throughout the entirety of the conversation. So please just feel free to use the chat.
Thanks, Caitlin. I appreciate it. Hi, everybody. I'm Angela Champion-Sproul, Senior Director of Development for the School of Public Health, and just wanted to welcome everyone here today. This is part of our ongoing series of virtual event and chats with alumni and friends. Today, we have Melissa Schreck, who is interviewing our School of Public Health and Information Sciences Alumnus of the Year, Dr. Doug Lorenz. A question and answer session will follow the interview, and you can use the Zoom chat to, as Caitlin said, pop those in throughout the conversation, and then we'll hold those and go to those questions during the Q&A and refer to those questions you may have submitted also when you registered for the event at that time. Our interviewer today, Melissa Schreck, is the Director of External Affairs and Strategic Planning for the School of Public Health and Information Sciences. She's been with the University of Louisville School of Public Health and Information Sciences since 2004. In her current position, she leads initiatives to improve communication and collaboration among the school's external and internal stakeholders. Thank you all again for joining us, and Melissa will take it from here.
Good afternoon, and thank you all for being here. It's my privilege to be the person who's interviewing Dr. Doug Lorenz today, the school's Alumnus of the Year. And I'm not going to read through his bio, which will save him some discomfort, although talking about himself is certainly not at the top of Doug's favorite things to do. Instead, I'm going to get Doug talking about his academic experiences, his professional experiences, so we can get a little bit more in depth than what you could read about in his bio. So this is an easy one. You came to UofL as an undergraduate, and you received 4 degrees in total. So you have a BA and an MA in mathematics.
Yes.
You have your MSPH in biostatistics and decision sciences, and then your PhD in applied and industrial mathematics. What attracted you to the University of Louisville in the first place?
Well, there were 2 main factors behind that decision. One was I was looking to go away for college, just sort of, get the experience of being on my own. But I didn't want to go so far away, like in the Midwest or the West Coast or anything like that, to where, my parents and my family weren't farther than a stone's throw away. So
because you're from Cincinnati.
yes, I'm originally from Northern Kentucky. I should have led with that, but I just wanted to make sure that, I was at a distance and for the most part on my own. And then the second consideration was I had participated in the state of Kentucky's Governor Scholars Program in my rising senior summer in high school. And the University of Louisville is very, very generous to graduates of the Governor Scholars Program. So there was a lot of financial incentive to come here. The tuition and room were covered. And that was very, very important to me too. And then lastly, there's a minor kind of silly consideration is that they had come off a historically bad baseball season. I had played baseball in high school. They had a new coach, and I thought maybe I could slip onto the baseball team.
Which you did.
I did, yes.
You played baseball for 4 years and was captain.
Yep.
Was that your senior year?
Yes,
You were captain?
yes, it was.
Okay. And so it's my understanding that, and I think it's pretty well known, that baseball and math sort of go hand in glove. So tell me, is that your story too? Did you have some early connections with that, baseball and math?
Absolutely, absolutely. As a kid, I adored everything about baseball, playing it, watching it, listening to it on the radio. checking box scores in the newspaper. But also I learned at a very young age to score a baseball game. Not everybody might be familiar with this, but there is, you can buy score books at any baseball game. And there's a numeric system for the players in the field. There's codes for certain actions that happen on the field, and you can score all 9 innings of a baseball game. And so I learned to do this at a very young age. And I would listen to Cincinnati Reds games on the radio. They were my local team. And I got to a point where I wanted to try and score the games myself and put together box scores to beat the newspaper the next day. So I got out a ruler and a piece of paper, and I drew up scorecards for myself. And I would sit in my living room and score baseball games. Now, baseball games start at 7:30, and my young bedtime was 8 or 9 o'clock, so I never got to really finish a game. But there is certainly a math connection there. It's all codes. Doing the tallies at the end of the game where you tally up at bats, hits, RBIs, runs, stuff like that. Definitely a math connection.
So does that continue today? Do you still follow box score? I mean, it's a big time for baseball right now.
Yes, October is the best time of the year. The playoffs are ongoing. I haven't scored a game in several years, but if the opportunity presents itself, where I can go to a baseball game, and maybe I don't have to be social, or I don't have to watch my kids or anything, I would most certainly grab a scorebook and score the entire game, and I would adore it.
That is
I would adore
that
it.
is the fun time.
Yes, it is.
I
Yes, it is.
understand. Well, you studied math, obviously, in your
Mhm.
undergrad, and what set you on that trajectory? Like, what was that decision like?
So I had always been pretty talented at math, going all the way back to grade school. I was on my grade school's math counts team. On my high school's quick recall team, I was the math guy. I would be the one to answer the math questions. But when I got to UofL, like many students that start as freshmen, I was really uncertain about what I wanted to do with my life. And, honestly, the only thing I wanted to do was play baseball. So I hadn't really given thought to, actual careers that were attainable for me. So I wasn't certain. Now, at the time, the NCAA required you to declare a major in order to play. So just out of a hat, I picked chemistry and did not like it so much. But, I was allowed to switch majors as long as I kept a major. So after chemistry, it was biology. But all this time, while I'm bouncing between these fields, I am taking math classes well beyond the gen ed requirements. So I think it was in my sophomore spring semester, my 4th semester at UofL. At that point, I'm 4 math classes deep into a math major. I'm taking stuff like differential equations and abstract algebra. And an advisor tells me, "Are you going to study math? Because you look like you're studying math." And I realized that, the most enjoyment that I got out of my school day, at least the in-class part, was when I was in my math classes. And so it just made sense. I had already worked my way through a good portion of it, and I was having fun with it. So I just continued.
And you knew at that point that you wanted to go ahead and pursue your master's in math. Did you know that right away at when you were graduating with your undergraduate, or was that something?
Not really. It was something that I was interested in, and I had in my senior year, I had applied to graduate schools.
Okay.
But it wasn't certain. I had also interviewed for a couple of jobs, like actual, full-time jobs that you get when you graduate from undergrad. But when it came time to decide, I got a couple job offers. I got a couple grad school offers. It felt right to continue with what I was doing. And there's evidence that, getting that graduate degree in math can be beneficial for your career path. So I just decided to continue.
Okay. And we didn't talk about this before, so I apologize, but when did you decide to go for the MSPH? Like, how did that come about?
So I was living, I was obviously still here in Louisville.
Right.
And, I think the common conception about math is, it's a very, very powerful pet to have in the job market. But at the time, I was happy in Louisville. I was dating my now wife, and she was in school and was not going anywhere. I wasn't interested in going anywhere, and job opportunities for somebody with the qualifications that I had were not they just weren't there. And then I had, the graduate student pool, and I guess the faculty as well in the math department had started been hearing from the School of Public Health and the Department of Bioinformatics and Biostatistics, like, hey, we're launching this program, check and see if you're interested in. I took a couple of flyers, I looked at the curriculum, it sounded interesting. It also sounded like it could lead to a more definitive career path, especially something local, since I wanted to kind of stay in Louisville. So my master's in math extended beyond the usual 2 years. And in that additional semester where I was finishing up my master's in math is when I also started it on the MSPH.
Okay, yeah, because you would have been in a super early cohort in
Yes.
that group, because
Yes.
we had just formed as a school, so lucky for us to have you as an early alum out of there. And I think we should probably take a minute here and have you talk a little bit about what distinguishes biostatistics
Sure.
from standard statistics.
Sure. So biostatistics is largely the development and application of statistical methods that are commonly used on data sets that are derived from biomedical or health related studies. Now there's, at an elementary level, like the basic methods and the basic toolkit for biostatistics is very, very similar to the basic toolkit that a statistics student would learn. And I tell this, I still teach our Introduction to Biostatistics sequence for our MPH degree. And I tell all the students that, like, we are just opening up the toolkit of statistics, and this class will look a lot like a regular statistics class. But as you dive a little bit deeper, there are certain methods that you need to be familiar with if you're going to be working with biomedical and health data. The most common example I throw out is methods of survival analysis, which is when you're looking at variables that measure the time to something happening, like the time to tumor remission in a cancer study or something like that. That's something that a statistics program won't cover, but a biostatistics program will.
Right, that makes sense to me, yeah. And I offered for Doug to teach us a lesson today, but he graciously declined. So you'll have to find out how to conduct a survival analysis on your own time. So in 2003 is when you were hired by the school, and you worked in the newly formed Statistical Consulting Center. So that was, again, the very beginning stages. So will you talk a little bit about what that was like?
Sure. And it was a really busy time for, I guess, everybody that's around back then, because, programs were being defined, departments were forming, academic units were forming, and the consulting center was just starting. And, to be honest, at the start, there was nothing to do. We didn't have collaborators or investigators that even knew about us. So there was a lot of, building, creating a website, getting business cards, printing promotional materials and distributing them, giving talks at certain pockets on the health sciences campus and talking to people and saying, hey, we exist. This is our service. This is what we can do. And still do. That's true. But there was some infrastructure already for statistical consulting. It had previously been offered by IT.
Oh.
And that was actually, it was just sort of like a side service that they offered at the time. And there was the story that I heard was there was just one statistician serving the entire university, horribly overworked, just unable to be responsive in any capacity. So what I was told by the director of the consulting center at the time, Bill Rising, was that, look, there is a not great attitude about statistical consulting on this campus and at this university. He's like, that's one of the things that's one of the hurdles we're going to have to jump over. So after we started, getting some collaborators and investigators coming in, we were trying to build relationships, not just say, hey, look, we're happy to help you tell your friends, but also making sure that we were, going the whole 9 yards for every single person, regardless of the scope or size or the purpose of their project. I mean, even if it was, one of our early relationships was with pediatric emergency medicine here at UofL. And they would send all of their residents. All of their residents were required to do a research project. And the director there at the time of research said, you have to get statistical consulting. So that was one of our earliest sort of pockets of investigators that came in. And we just sort of took it as an attitude, and I personally took it as an attitude, like, you know, I don't care if this resident is intending to go on to do research in their life, or if they're just doing this so they can get done with it and go be a practicing physician. You know, they're going to get my full attention. They're going to get everything that they possibly need. And it was important for us to sort of develop a reputation in that way.
And there was continuous learning for you at that point too. I mean, you know, you all were starting out new, but lots of different methods were being introduced.
Right. And also my line of study for the MSPH was actually in decision science. I was biostatistics light. So
Okay.
while I was conversant in statistics, I was nowhere where I felt comfortable, especially with some of the more advanced methods. So there are consulting centers at most, you know, major universities nationally, and a lot of them very helpfully will publish data sets that they've worked on with recommendations for, hey, try this analysis with this data set. And I used those to learn new methods, but also to sort of broaden the scope of what I could do, you know, making sure that I was conversant in all the software packages and just ready to help anybody in whatever way they needed.
Yeah, I mean, so that foundation that you created, I mean, obviously, you know, the statistical consulting center is still going, and now you've worked with countless investigators. You have 70 plus publications that are peer reviewed. You have 40 plus conference presentations. So you've been very productive. So really, you're the expert to me on collaboration. So in this world, so what makes being a collaborative methodologist like you are so rewarding? Like, what is it about that?
In my professional and even my personal life, I feel like I get a lot out of, you know, helping people. And, you know, math and statistics specifically is a talent and a pet that I have. And it just so happens to be a pet that a lot of other people don't have. And a lot of other people sort of are afraid to even attempt. So to be able to use a talent that I have that a lot of other people don't, and a lot of other people look at adversely, to be able to use that to help people, you know, move their research along. That's always really, really rewarding for me. You know, the end product, you know, is typically either, you know, it's a manuscript or a presentation, like you said, or we're working with somebody early on in a project and we're helping them to get some of their research funded or something like that. You know, those are all well and good, but just the feeling of being able to, you know, assist somebody with, you know, a talent that I have is very rewarding for me.
And you know, so that goes, you have this value system that's driving your work. So clearly that's important for your success. Do you have other ideas on what makes for effective collaborations?
I preach this even in the introductory level classes that I teach. It is far and away communication. You know, it's a two-way street, and we've talked about this before. It's sort of the one-way street where I take data that I get from somebody and I do these complex analyses, and the computer spits out all of these, you know, esoteric numbers and things that people just don't understand. You know, I can just hand that over to people, or I can, you know, package it in a way that makes sense to them, that they can communicate to others beyond. And that's really at the heart of what we do when we write manuscripts, is being able to take some of these complex results and sort of translating them to where they're interpretable and understandable by an audience. But the other side of that coin of communication is, you know, sort of listening. You know, we get a lot of people that are very, very deep into some very, very complex basic sciences, you know, genetic research or things like that. And it's stuff that, you know, sometimes that, you know, maybe they don't do a good job of communicating to me, and it's contingent upon me as a collaborator to make sure that that I'm very, very explicit with them. I don't understand what you just said. You know, what's going on with this. That happens in just about every meeting. I don't think quickly on my feet most of the time. And I need to make sure that they are able to get down on my level. And, you know, as a service, I try to make sure that I can get down on their level when I'm talking about statistics.
That makes sense to me.
Yeah.
So one of your early experiences you were talking about the pediatric emergency group, and
Mhm.
that was Dr. Mary Clyde Pierce.
Correct.
Right? So why don't you talk a little bit about the work you've done with her and the significance of the projects that you all have done?
Sure. Mary Clyde was she was the director of research for that pediatric emergency division, and she was the one. She's very, very big on statistical consulting. It's very important to her. It always has been, and she was the one that was pushing those residents and fellows to come to our consulting center. And after we had done it for about 2 or 3 years, she showed up in her office. She showed up in my office with her right-hand person. Her name's Kim Kazar. But they showed up in my office and they had this idea. Their primary area of research was child abuse. And they had this sort of nugget of an idea that, the young kids, age 4 and under, that they could do a skin exam, look at the bruises on the child's body, and have a reasonable idea if there was suspicion or no suspicion of abuse. Like, for example, if the kid's got a bruise on his shin, so what? Like, I pull up my pants leg right now, and I got bruises on my shin, and I'm an adult. But other places are a little bit more sensitive. And at the time, again, they had this idea, and they wanted to do a pilot study out of it, and they did. And that was one of my first sort of bigger publications on my CV, was with them in the Journal of Pediatrics, where they piloted this decision rule that said that bruises in certain regions of the body are potential markers of abuse. That sort of snowballed into funding applications with the NIH. She got a major grant to study this at a much larger level, and the rest is not really history because we're still actively working on it. But we were able to validate and refine the original idea that she had, and sort of add some regions of the body that are also suspicious. But her study, it was comprehensive. It wasn't just about bruising profiles for kids. It was also about psychosocial characteristics of the kid's family, or the caregiver at the time of the incident. It's spawned all these different lines of research, and it's been I'm a parent, and it's hard for me sometimes to do this kind of research because you have to listen to these stories about these kids. But it's been really, really rewarding to get these things out there. It's the publication is fine, but the fact that we know of and are aware of people that are using these rules, these decision rules in practice in pediatric emergency rooms is just, that's probably the most rewarding thing that I can think of in my career.
And the sort of that, I don't want to say pinnacle, but sort of a benchmark for that is your all's recent publication in JAMA.
Yes.
Like, to have that screening tool now
Yes.
out there, and what that's going to probably yield more.
Yes, and that's that was the big one. That's, I forget the exact year she walked into my office. I want to say it was 2006, but that publication just came out this past year. And it was 15 years in the making. It's been a lot of hard work, but it is no doubt the thing I'm probably most proud of in my career.
Congratulations on
Thanks,
that.
I appreciate that.
So let's talk about your experience as a faculty member. You got your PhD in 2011 and joined the Department of Bioinformatics and Biostatistics thereafter.
Yes.
So you're currently, it's been 10 years now. So you're an associate professor. What do you enjoy most about being a faculty member?
Initially, and this has kind of continued, it was, as faculty, I had more autonomy on what I would get to do with my research, because working in the consulting center, it's catch as catch can. If somebody comes in and they have a need, then we have to service that need. And I'm always happy to work with people, but some projects weren't particularly stimulating or interesting to me personally. And then all of a sudden, I get hired on as faculty, and I have right of refusal if I want to. I have the right and the privilege to pursue the things that interest me, like continuing with my dissertation research, or continuing to work with Dr. Pierce, or continuing to work with faculty where she is now at Northwestern University. And that was really, really nice. But being perfectly honest, I really, really enjoy teaching. That's always been something that's always appealed to me. Even back, I remember before I got the job at the consulting center in 2003, I was still not certain what I was going to do with my degree. And I was working for an in-home tutoring service. I was teaching at JCC. And, you know, despite the fact that they weren't particularly lucrative, and it was kind of rough because the in-home tutoring, I was being sent out to Shelby County, and I was teaching at JCC Southwest, which is way at the end of the Snyder. Was driving all over the city, but it was consistently the best part of my week when I got to tutor kids and when I got to teach these students. And so when I joined the faculty, and you know, and at first I was teaching a variety of classes, that was again continued to be the best part of my week, engaging with students and things like that.
Absolutely. And one of the big successes, it was being named in 2014 a top 4 faculty member, a faculty favorite, and you continually get those nominations. So we got a question from one of the attendees today asking, what attributes do you believe led to students recognizing you or others as an excellent teacher, a great teacher?
Well, I would be remiss if I didn't say that the top 4 award in 2014, that's more of a reflection of that particular class of students. That was my first time teaching that course sequence for the MPH degree, the Introduction to Biostatistics 1 and 2. I was insanely nervous and just not certain at all if what I was doing was landing with the students, if it was useful to them in the degree programs. But to their credit, they gave back. They engaged with me. They engaged with the things that I was assigning, which in retrospect were ridiculously difficult for that level of class. But they attended class every day. They didn't complain. They did the work. They asked questions. They kept in touch with me. So I'm always eternally grateful to that class. But I don't know if I had to pinpoint it why students are nominating me. It's I do try to make myself as accessible as possible. And that's just across the board for all the classes that I teach. You know, I teach some online classes for our online Masters in Biostatistics. And due to the nature of the kinds of students we attract, they're typically not available on weekdays. They're doing their work on weekends. That means checking in with my email, checking my voicemails and things. I have night due dates for some of the assignments that I give. So, 7 p.m., 8 p.m., I have to check email, and I'm fine with that. But I do try to make myself as accessible as possible to them.
Right. And having those core classes still, like you're still teaching those in PH.
Yes.
That has to, that course continues, and it's a real passion for you.
Yes, everybody that gets the MPH degree at least has to take part 1, and a lot of them have to take both parts. So in that first year, I guess I'm probably one of the professors that they see most often. And I want them to do well. And I fully acknowledge that 90% of the students that are in my class for the MPH hate biostatistics and are just displeased that they have to take it. And I try to take the tack that I'm trying, I don't want them to enjoy it so much, but I want them at least to get it and to not hate it so much, that to where they can tolerate it and that they learn something that's useful for their degree programs.
Right, and that they can maybe use that as collaborators in the future.
Absolutely.
That'll make them good consumers.
Absolutely.
As well.
And I always tell students after the last session of class that, my door is always open to anybody that, gets through this course sequence. If you in the future, because a lot of them are going to be working with data, with our practicum program in the MPH, it's important that they have access to a resource that can, assist them if they get stuck.
Yeah. So, that I would love to sit here and keep talking. And actually, if it were up to me, we'd be talking about all kinds of random things like your wife, Melissa, and your kiddos, which do you want to do a shout out in case, they're, they're watching the recording. But it is time for us to start wrapping up. So want to leave this conversation by finding out from you, what advice do you have for students who are about to graduate?
Mm-hmm.
And do you have any tips for their success?
Hard work. hard work is, hard work is always in demand. And always keeping your eyes open for opportunities is really, really important too. And those two things kind of go together. Sometimes it's the opportunity that you weren't even aware of that makes itself known to you because you worked hard on something. Like you're taking a class that's an elective and not terribly important towards your degree, but you put forth the effort, and that instructor knows somebody that knows somebody else that has a job opening for when you're graduating. If you're consistently putting forth the effort across the board and everything that you're doing, opportunities open up for you. And that's kind of been the story of my career at Louisville. Putting forth the effort for pediatric emergency residents led me to, some of the larger things that I've done as a faculty member here.
And great success on the baseball field, right? Your all's team was their championship involved.
No.
Okay.
No, the baseball team at that time was a far cry from the machine that it is now. I would love to be able to say that we were awesome, but I can't.
Well, I'm sure that it was fun.
Oh, yeah,
regardless.
I had a blast. I wouldn't trade it.
Well, thank you for being with us today. And I am going to turn it over to Angela and Paige for some Q&A. But first, it's my privilege to present you with the school's Alumnus of the Year award. We actually do have an award. I can get it out of its little magic box. So on behalf of the dean and your colleagues and the students, I want to say congratulations. And
Very nice.
it's very well deserved.
Thank you. I appreciate that. Thank you so much.
All right, let's see, Paige and Angela, turning it over to you.
Sure, thank you. So thanks again, and thanks for everyone who's been able to join us. And I hope that you were able to learn a little bit about Doug's career path and his professional contributions. At this time, Paige is going to moderate questions and that were submitted both in the chat and when you registered for the event. And if you haven't done so, go ahead and submit what you would like to pose to him now. There might be a few fun comments in there right now that we could share while you're thinking of great things to ask him. Paige, are there any questions?
Yeah, so we got a few here, a couple about baseball, so we'll come back to those. So Angela said she loved hearing about the process of how a study creates new questions and new research as information is learned. She thinks this is a critical thing for the public to understand about science and research. What would you want the public to better understand about scientific inquiry?
That it's always evolving. I completely agree with the contention that there's this idea that a theory is that many people think that a theory, a scientific theory, is something that's concrete and that needs to be static as new avenues of inquiry and new information is developed. And I think that can be really reductive. Theories need the space to evolve as more information is gathered. I think that's probably playing out right now as we watch the pandemic happen. There's things that we thought in June of 2020 that are not remotely true anymore. But it's not that the ideas were wrong back then, it's that they've evolved as we have learned more and more.
Okay, thank you for that. So going to the baseball question. So Melissa got a shout out for a nice pun about the hand and glove.
Thank you.
So just giving her some love there. Craig was wanting to know, how often do you use baseball statistics to drive home a point in class?
I think I've done it one or two times, but honestly, the class is really, really fast paced. We just move from this to that, to this to that. And if I wasn't focusing on applications, much as I would love to throw in a batting average or one of the advanced metrics that people are throwing around these days for baseball, I worry that it's not on brand or on message enough for our MPH students, and then I would very much risk losing them. But man, would I love to. I would just love to have a session on baseball, but I couldn't do it.
Maybe you could do it as an undergrad course. Maybe, make some fans out there, you know, the undergrads, and we'll just bring them into the school.
I absolutely.
And really,
absolutely.
Craig's, it was a trick question. He wants to make sure you're not talking about baseball all the time in biostat, so that our students are being successful.
And I
It's
will
tricky.
confess, conversations have derailed in class before when I have been asked something like that. But I do try to stay on message. I get a finite amount of time with them, and I got to make sure they learn what they need to learn.
Nice. And then Angela would like to know how we can harness your statistical knowledge to have our own Moneyball system to raise money for SPHIS.
Oh.
Angela's putting me on point here, but I would be glad to do that. I would be glad to do that. I could not offer any ideas right now, but I'm certain there are ways to do that for sure.
And then we just had one come in from Jen Forrestal, our alumna of the year from last year. So she's wanting to know, is there a professor who had a significant impact on your education or career?
Yes. Somnath Datta, he was faculty here in the School of Public Health and Department of Bioinformatics and Biostatistics. He was my PhD mentor. And we were sort of put together not because of my dissertation research, but there was a heavy need for collaboration in our university's Department of Neurological Surgery, the work that they're doing at the Spinal Cord Injury Rehabilitation Center. And Somnath and I were assigned to work with them. And we worked very well together. We got a lot of traction out of that research, a lot of publications, a lot of presentations for that group, but it also spurred some research ideas that he had. And prior to my dissertation, I sort of worked on some of those things. And then when I sort of let him know, because I was getting my PhD in math, not here at the Department of Bioinformatics and Biostatistics, once I let him know that I was doing that, he said, I would like in on that. So he was my co-advisor with Ryan Gill from the math department. But he was such a major force in my course of study, because I was on a sort of a non-traditional path as a PhD student. I was working full-time and doing the PhD part-time. And anybody that's, worked on a dissertation before, momentum is just such a key component of that. It was very, very hard for me to get and maintain momentum towards my dissertation and still, raise 4 kids and have my full-time job. And he was just instrumental in that. Like, it was always a poke or a prod, like, are those simulations done? Have you figured this yet? Have you figured this out yet? And it was never forceful. It was never angry or mean. It was just, hey, this is how we do research. This is how things move forward. Let's keep pushing forward. And I'm always grateful.
All right, let me just have one more come in from Emmanuel, I believe. Sorry if I'm pronouncing that incorrectly, but he's asking, what advice do you have in making biostatistics more likable or understandable to students?
That's a difficult question. So most of the things that I teach in our MPH classes are pretty basic. And I feel like are accessible to anybody that's capable of negotiating our MPH program. But a lot of students will go on to more advanced classes and more advanced methodologies and things like that. They'll start learning some really, really complex things. I'll harp on it again. Melissa and I talked about it already, but the ability to communicate about some of these more advanced things that are in our toolkit as we learn statistics, the ability to do that is really, really critical. And also a lot of I think where people kind of hit a brick wall with statistics is when they start learning some more advanced things in some of their more advanced classes. But 9 times out of 10, it's always the case that some of these advanced methods are putting fancy spins on some very, very simple concepts. And being able to relate those simple concepts to the more fancy results that they're generating, it not only makes things easier to understand, but making those connections displays to others that you understand the connection as well. That you're not just you have a new car that you're driving around and you don't know how to operate it. That yes, I do understand this. yes, I do understand the foundations of this. That's always been something, and I served on a lot of research committees for master's degrees and doctoral degrees in the School of Public Health and outside. And that's something that I always try to communicate to the students that I'm working with, is that, you know, be able to make those connections between the simple and the complex. It's really, really important.
I'll jump in real quick. I do have, I was thinking when you were talking that over the last, I can't remember when we started the MS in biostatistics online. But at that point, you eventually became the director
Yes.
of that program. So
Yes.
that's a new toolkit that you developed
Yes.
as well. So what has being a program director and working in an online environment taught you? What lessons learned can you share with us on that?
Well,
So I said it's a little challenging. I mean, obviously,
Right.
especially for a new program. I
Right.
mean, you got thrown in like super deep end on that.
well, I guess if I was going to give advice to a faculty person that was thinking about developing a course online, the advice would be, do not underestimate the amount of work that it takes to get a course online. We had all the faculty that are involved with our online master's degree working a year in advance to put together content and videos, you know, learning how to set up course spaces in our content management system. It is a massive amount of work that should never be underestimated. But one of the things that I've learned, at least, you know, because we are a fledgling program, our master's is now in its 4th year, our certificate is in its 3rd year, and we're still growing and we're still learning. But one of the things that I've learned is lessons that I've learned in face-to-face teaching also apply to online learning. And that main lesson is that accessibility really matters to the online student. You know, in this day and age, you know, where you can get in touch with somebody in a second with an email or a phone call, or, you know, even online in some capacity, it's really important. I mean, with boundaries, obviously, you know, I don't have to be available 24 hours a day, but it's really important, these students and these prospective students that we have, that we're accessible to them, that we can answer their questions and answer them quickly, because, you know, a lot of times they're making, you know, lightning quick decisions about, you know, taking this class or taking that class or even entering the program, and being able to, you know, answer questions, give them information that they need is really important. Yeah.
All right. That appears to be all of our questions. Wanda offered her congratulations. So I'm sure that if anybody has any additional questions, Doug would be happy to answer those offline. So feel
Absolutely.
free to reach out. We can provide his contact information if needed, but I'll turn it back over to Angela.
Angela, before, can I pop in real quick? I want to thank Paige Wills for being our Q&A. She's not been on camera. She's the voice offline and works in as the manager of communication marketing. Of course, I want to thank you for
course.
spending
Thank
the
you.
time today and for accepting this honor.
Thank
It's not easy to be recognized this way, and we will, I'll be watching, I'm sure. We'll all pull up chairs to watch next Thursday when you have the big event, the 2021 awards, where you'll be receiving the recognition at the university level with your peers. So thank you for that. Is there anything, you know, we didn't force you to have an acceptance speech or anything yet, but is there anything you'd like to say?
No, I just, this is, I feel like we have so many graduates that are doing so many like cool, neat and wonderful things. You know, at least ones that I'm aware of, people that I've taught or just engaged with in some capacity. It makes me feel a little undeserving of this, because there are so many people that are doing so many awesome things, that this is really an honor and privilege, and I'm very thankful.
Great. Well, we look forward to celebrating all those achievements of our other alumni over the years too. So we'll get them all in.
Yeah, it's great.
Okay.
That's great.
Thank you.
Mhm.
Angela, back to you.
Okay, thank you all. And thanks for everybody who chimed in. There is in the chat information about how to get onto the Alumni Awards, because they will be streamed. And, you know, it's more of a limited capacity award that program, but we are really glad that it will be in person. in smaller numbers and then still streamed for everyone who can't be there in person. So if you want to see all of our alumni who are fellows and all the new categories as well, you can check it out next week, or I'm sorry, not next week. I think I'm speeding up the month of October more than necessary, but the 21st. So anyhow, we are also, just to let you know that I may have popped some archival information in the chat from Doug's baseball career. So you can click on that and open it. I don't know how to share it with everyone on this platform. I think we could do it on Zoom, on Teams, but I don't know how to do it on Zoom. So and Doug is never going to forgive me for any of that. So,
But you wanted him to work on some modeling. Now you
I know, but it's really great. And I also wanted to just say, to Doug's point, we have amazing alumni, and every year we ask for your nominations. So if you're thinking about those other folks that you think should also be recognized, please, please, starting next spring, we will be, you know, in the summertime, we start calling for nominations, and think about those folks and try to elevate more people that we can recognize and share the spotlight for next year as well. So I was totally off script, but I think it should be said because it takes, you know, caring people like you to elevate others as well. So thanks again for joining us, and you'll be receiving a follow-up email for feedback about how this event went. We would love to hear from you and also connect further. And is there anything else anyone wants to share before we sign off? We have exhausted all our thoughts for the day. So thank you all so much. Have a great day.
Thank you.
Thanks.